Hello, dear nursing aspirants. Welcome you all to the Master Nursing classes. Myself, Mr. Nagaraj, AIMS Nursing Officer, and your Norcet mentor and guide. So, here in front of you all today to discuss the very important questions for our upcoming Norcet exams. Students, this class are not only focusing over the Norcets. This class are focusing over those very important concept of the nursing, where there is an highest chance of coming question in each and every exams, that including the all state and all central government exams and all upcoming our central government exams like Banaras Hindu University, Dsssb, AIMS Institute of All India Institute of the Ayurveda, and all our AIMS SNO exams also. The important questions where the examiner are focusing, the questions where they're repeatedly asking in the different format. I am trying to build those concepts where you can solve the each and every question with the right approach. Okay, where you can understand the each and every question in the right direction. Students, the solving the question is completely depends on the understanding question. So I will guide you how the question may arise from the particular topic, so you can go with that particular knowledge and get the good marks in the exams. Students, it's very important to understand the concept rather than the questions. For each and every questions, I have tried my level best and referred the best books to explain the things for you. So do watch the video completely till the end. If the content found informative, if the explanation found best for you all, don't forget to hit the like button and the subscribe button. So these classes will be daily live at the 9 p.m. at the night. So where you all can watch live only. Okay. If you are unable to watch the live videos at the night 9 p.m., you can watch the video in the mornings also, early in the morning. And one special request for you all, have one good notebook and pen with you all while watching my video. So do write the all the important points what I am explaining and the concept what I am trying to tell you. So those concepts only going to help in the exam, students, not the questions. Remember, for each and every concept questions, I will explain the concept where you can go with the concept for the exams. Okay, so without wasting the time, we'll start our today's class. So here is the first question of the day. Read the question carefully, completely, and try to answer for the question. Yes. Which of the first question is like this: while assessing the patient with the pressure ulcer, the ulcer is found with a slug and a scar. This is classified as which stage? So the option A is stage 2, option B is stage 3, option C is undifferentiated stage, and option 4, that is the option D, is stage 4. Students, it's very important to understand what is the pressure ulcer. So what are the other names of the pressure ulcer? Then we will go for the our staging of the pressure ulcer. Pressure ulcer is an ulcer which is forming at those bony prominence, means in our body some areas are the pressure areas where there is the bone is prominent, like occiput of our head, sacrum of our pelvic area. Okay, so and the lateral and medial malleolus of the foot, where there is a bone is out protruded and it's a pressure area where there is the simple pressure for the prolonged time which create the ulcer at that point. So that is what we call the pressure ulcer. The other names of the pressure ulcers are like these. The pressure ulcers are also called as the decubitus ulcer. The pressure ulcers are also called as bed sores. Why? Because it's called as a bed sore means these ulcers are mainly occurs in the hospitalized person with a special bedridden persons, like stroke, like paralysis. Okay, where the person unable to walk out of the bed and he is completely retained to the bed for an months together and a year together, where due to the consistent pressure over the bony prominence, the pressure will increases and the skin will get breakdown and the our ulcer is forming. So because of that, we call this one as in the bed sore and it is called as in the decubitus ulcer. So now tell me the classification of the pressure ulcer, how we will classify. Yes, I hope all of you will do your best answer for this question, because it's a very important and it's a very easy question. Okay, so while assessing the patient with a pressure ulcer, the ulcer is found with a slug and a scar. So this is what we call this classified under which stage? Yes, option A is the our stage 2, option B is stage 3, and option D is stage 4. Students, look at the images. Yes, who all are giving the option C, your answer is 100% correct. Now we will quickly revise the stages of the pressure ulcer Okay, where if other questions are arising from this question, you can understand easily. So this is the our first layer of the skin, that is the epidermis. Under the epidermis there is a dermis, and this is what we call the subcutaneous tissue. And behind the subcutaneous tissue we call this one as hypodermis, or else we call this one as an, yes, subcutaneous fat. And soft tissue and the bone is there. Okay, so in this soft tissues, in the some areas the muscles also will come. Okay, so this is how our stage is, our skin is lined like this. Okay, so if in the first stage of the ulcer means the area is only red in color and the skin is completely integrated, there is no any breakage in the integrity of the skin. In the stage 1, the red area is only red and the layer involved is only and only epidermis, students. Only and only epidermis will be involved and the area is red in color. So that is what we call the stage 1 pressure ulcer. Okay, in the stage 2, epidermis plus dermis will be involved. Up to here the pressure will be extended. Look at the images. Okay, up to here. Stage 1 means the integrity of the skin is stage 2, the integrity of the skin is broken and the pressure is extended up to the our dermis. So this one what we call the stage 2. The examiner may give the clues where there is then the pressure ulcer with the blisters means your always answer goes for the stage 2. And the pressure ulcer with the highest pain, your answer will goes to the stage 2. Remember students, if the examiner giving a clue of the blister, the clue of the highest pain, your answer will be going to the stage 2 pressure ulcer. Okay, why? Because here there is in the fluid filled blister will formation in the stage 2. Okay, fluid filled blister will be formation in the stage 2. So you can answer easily for the stage 2. The skin involved is only epidermis and dermis. So now come for the stage 3, where the skin involved is the epidermis, dermis plus subcutaneous tissue. Look at this image, number third image, where epidermis is damaged, dermis is damaged, and up to the subcutaneous tissue it's damaged. Okay, so this is what we call the stage 3 pressure ulcer. Okay, stage 3 pressure ulcer, up to the subcutaneous fat it is involved, means this much skin is in depth, it's a damage. Okay, so due to the consistent pressure. If in case the examiner is giving a clue, the pressure ulcer is involved until the soft tissue will come, until the muscles will seen, until the tendons, ligaments and bones are exposed, so that one we call as in the stage 4 pressure ulcer. Students, very very importantly, all the layers of the skin are involved in the stage 4 pressure ulcer, that is including the epidermis, dermis, subcutaneous fat, soft tissue and the bone. Students, very very importantly, keep in your mind, if the examiner giving the clue of appearance of the muscles, bone, tendons, ligament and soft tissue, your answer will be always goes for the stage 4 pressure ulcer. This is the highest stage of the pressure ulcer, where the bone is also exposed to the environment. Okay, if in case like this we found the case means what we can classify this one. What is this? This is the black color slug. Sorry, this is the black color eschar which is covering the layers of the our. This is the black color layer which is covering the our pressure ulcer. We call this one as in the scar filled pressure ulcer, or else we see this one as in the, yes, undifferentiated or unstageable pressure ulcer. Why? Because we can't seeing the exposed area because of the covered by the scar or covered by the slug. What is slug? Slug is in the soft, soapy, pussy material which is present inside the our what we call the decubitus ulcer, that is what we call the slug. And the scar is then hard, black and tight fibrous layer which is forming over the ulcer, that is what we call as in the scar. If it is slug and covered by the slug and scar, we call that one as in the undifferentiated stage. I hope all the stages of the pressure ulcer you all guys are understood. Okay, so the answer for this question goes to the undifferentiated. Keep remember, one question definitely will come in your Norcet 6, so don't regret after coming from the exams. Read the all pressure ulcers components completely. Okay, revise twice and go for the exams. Okay, here is the next question. Yes, read the question carefully, completely, and try to give your best answer for the question. The question is like this: while assessing the newborn, primary healthcare provider found scaphoid shaped abdomen, bowel sounds in the chest, and manifest with the respiratory distress. What may be the expected condition? Students, what happening here? The primary healthcare provider assessing one newborn Okay, and he is finding the shape of the abdomen is scaphoid shape like this. And when he places the stethoscope over the chest, he is hearing the bowel sound in the chest. Students, the bowel sound is usually heard in the abdominal cavity. Now, what happening in this condition? The bowel sound is hearing over the chest. Okay, so simple and the best answer I want from you all. I hope you all are getting the answer now only. But read the question completely till the end. Okay, so newborn primary healthcare provider assessing the newborn and he is finding the scaphoid shaped chest and the bowel sound is in the chest and manifest with the respiratory distress. So, what may be the expected condition? Option A is the hiatal hernia. Option B is the congenital diaphragmatic hernia. Option C is umbilical hernia and option D is the inguinal hernia. Now I want answer for this question. So understand the question and try to give your best answer for this question. Yes, I am waiting for your answer. Who all are live for the class? Do comment and do like the class. Students who all are live just now, press your like button. Get I can understand you people are live in the class. Okay. Yes. B B A B. No students. Yes, wait. Who all are giving the answer as an A? Just wait for the explanation. The answer for this question is in the congenital diaphragmatic hernia. So look at this image. We will understand very easily. Look at this one. I will explain the difference between the congenital diaphragmatic hernia and the hiatal hernia. Don't worry. So this is the baby. Okay, where the abdomen of the baby is in the scaphoid shape. Okay, so this is what we call the scaphoid shape. If it is like this, we call this one as the scaphoid shape. Okay, so the bowels of the baby is in the chest. So because of that, the primary healthcare provider hearing the bowel sound in the thoracic cavity. This occurs due to the congenital deformities of the our diaphragm muscle. Now tell me what is the diaphragm. Diaphragm is a very important muscle, students, where it is separating the our thoracic cavity and the abdominal cavity, where it stands as a wall between the our thoracic cavity and abdominal cavity, which keeps the thoracic cavity organ above and the abdominal cavity organs below. So that is what we call the diaphragm. And one more question will arise on the diaphragm. The important muscles of respiration is the diaphragm, and the diaphragm is supplied by which nerve? Yes, that is our beautiful phrenic nerve. Okay, so that is our beautiful phrenic nerve. The diaphragm is supplied. Okay, now there is congenitally means it's from the birth. The defect is there in the our diaphragmatic muscle. Because of that, the separation of the our abdominal organs and our thoracic organ is not happening, and due to the increased intra-abdominal pressure, our organs of the abdomen is get entering into the thoracic cavity. So now it's causing the respiratory distress. This is what the examiner given in the history. Okay, this is what the examiner is given in the history. Yes, primary healthcare provider founding the scaphoid shaped heart, bowel sound in the chest, and manifest with the respiratory distress. Why? Because the bowel is covered in the respiratory system, where the lungs is completely collapsed, and the small left lung we are seeing here, and the bowel in the left side of the chest, and diaphragmatic hernia we are seeing here. So this is what we call as the congenital diaphragmatic hernia. And the EMS ask the question like this: in which of the following hernia the bag mask ventilation is contraindicated? The examiner asking means again the answer goes for the congenital diaphragmatic hernia. So if in case we are giving the bag mask ventilation means by applying the mask through the embo bag, we are giving the ventilation means we call that one as the bag mask ventilation. This is completely contraindicated in the baby who diagnosed with the congenital diaphragmatic hernia. Why? Because if we are giving the ventilations by the bag mask ventilation means it creates such a positive pressure at the lungs that where there is then the organs are getting damaged due to the increased intrathoracic pressure. Because of that, our bag mask ventilation is the completely contraindicated when the baby is getting diagnosed with the very beautiful what we call congenital diaphragmatic hernia. Okay, so the bag mask ventilation is completely contraindicated. Hope the one more question is solved here. Okay, so the answer for the question goes to the our congenital diaphragmatic hernia. Sir, now we are getting confusion. What is the hiatal hernia? There is also images there for the hiatal hernia. Look at the image. It is almost, it is not, it is also seen in the childhood period only, but also seen in the adults. Okay, where the diaphragm is having the one hole. Okay, this is the diaphragm, and it is having one, normally it is having one hole from which our esophagus will comes down, and from which our aorta will comes down. Okay, so this hole we call as the hiatus hole or the hial hole. Okay, very important. When there is a defect in the this hole or this particular orifice from where the esophagus and the stomach is the esophagus is coming down, if there is any weakness in the hiatus, our stomach will get protrudes above in the thoracic cavity. Only and only stomach and the our lower esophageal sphincter will get stomach protrudes in the our thoracic cavity. So this one we called as on the hiatal hernia that occurring due to the defect or that occurring due to the weakness of the our hiatus of the diaphragm. Okay, this occurs mainly. This is the normal, students. You can see this is the lower esophageal sphincter. This is the hole from the where yes the our esophagus came down. Okay, so this is the normal esophagus and the stomach. Okay, here you can see the lower esophageal sphincter. This white button you are seeing over the image. Okay, so this white button is the lower esophageal sphincter where it's gone inside the our thoracic cavity by passing the our diaphragmatic muscle, and the below is the our beautiful abdomen is there. So the abdomen also upper part, that is the fundus part of the abdomen is get protruded here both side. So if it is protruding both side, so we call this one as in the sliding hernia, students. This is the type 1 hiatal hernia or the sliding hernia where the both side of the funduses get protruded, and if it is only one side of the funduses get protruded, we call this one as the rolling hernia or the type 2 hiatal hernia. Okay, so this is the hiatal hernia complete, that is the mixed where the sliding and both rolling are there, that is the mixed hiatal hernia, that is the yes the type 3 hiatal hernia. This is what the hiatal hernia, and this is what the our congenital diaphragmatic hernia. In the congenital diaphragmatic hernia, remember the golden point, the bag mask ventilation is contraindicated. Okay, I have drawn the diagram also and I have cleared your concept. Okay, so hope the concept for this question is also very understandable, students. For each and every question I am building the concept, and for each and every question I am explaining the rationale to remember and solve the question very easily. So the class may go somewhat lengthy. Do watch the class till the end where it is very effective and where you will understanding the yes the small to small questions where you can focus and recognize and differentiate. So while solving the question, to differentiate between the two options is the very important. So the master nursing classes building the concept to differentiate the particular things. So focus over the concept explanation. Okay, so and note the important points while explaining also. Okay, so here is the next question. We will go for the next question. I want your active participation in the 100% answer for this question, because this is very repeatedly asked and the important question. Yes, this will definitely will come the among these four options, one option's answer will definitely come in your Norcet 6. Okay, so read the question completely carefully and try to answer for the question. I am waiting for your answer. Which of the following is an antidote for the benzodiazepines? Tell me the answer. Yes, option A is the protamine sulfate, option B is the desferrexamine, option C is the calcium gluconate, and option D is the flumazenil. Yes, can anyone answer for the question? Yes, students. Wow. So who all are giving the option D as the answer? Your answer is very beautiful and 100% correct, students. So if it is the same question coming in the exam also, so give the answer as a flumazenil. Yes. Which of the following is the antidote for the benzodiazepine? The benzodiazepines antidote is the our flumazenil. Okay. So now tell me, protamine sulfate is the antidote for. Comment fast, students. Very important. The protamine sulfate is the antidote for. Yes. Heparin. Students, remember for heparin antidote is the protamine sulfate. I have written the P big and I am writing here as in protamine sulfate for easy remembering for you all. Okay. So write like this in your notebook. Revise in the morning, and you will never ever forget the antidote of our heparin. That is the protamine sulfate. So what about the our desferrexamine? Desferrexamine is then the important antidote for the iron toxicity. Iron toxicity. That is the ferrox. You can identify as in the ferrox. Ferrox is then yes another name of the iron. Where desferrexamine is an antidote for the iron toxicity. You can remember like this. Okay. So next is the calcium gluconate. When there is then the magnesium sulfate toxicity, when there is then the overdose of the magnesium sulfate, we will give in the patient for the treating in the eclampsia. What is eclampsia? Yes, eclampsia is in the yes pregnancy induced hypertension with the seizures. We call as on the eclampsia, in the eclampsia and the severe pre-eclampsia, so we will give the, yes, the very important magnesium sulfate. If the dose went more, means we will manifest, the patient will manifest with the absent of the deep tendon reflex in the magnesium sulfate toxicity, decreased urine output and decreased respiratory rate. Remember the side effect of the magnesium sulfate toxicity. Magnesium sulfate we will give in the treatment of the our eclampsia. In the eclampsia, if it is meant the toxic, means the sign symptoms looks like this. Yes, all will decreases. Decreased deep tendon reflex, decreased urine output, decreased, yes, respiratory rate less than the 12 breaths per minute. So that is indicating the iron toxicity. So while giving the magnesium sulfate for the pre-eclampsia patient, always keep ready the calcium gluconate, where if it went the toxic, means we will give the calcium gluconate. This is an, yes, the very important antidote for the our MgSO4. That is the magnesium sulfate toxicity. Hope the concept is very much clear for this question. I am going to the next question. Yes, who all are given your answer as the best answer for the D. So your answer is 100% correct, students. The benzodiazepines antidote is the flumazenil. Okay. So here is the next question in front of you. Read the question carefully, completely, and try to answer for the question. Yes. Who all are live? So please press the like button and share the class with your friends, students, and your classmates also, where we can build our community very fast. Okay. So the question is like this: which of the following hormone responsible for developing the secondary sexual characteristics in the female, students? We are having the four options of the hormones. You have to identify those hormone, that hormone that is very important for the development of the secondary sexual characteristics. Now let me tell what is the secondary sexual characteristics, so you can understand very easily. So the secondary sexual characteristics in the female is mainly identify the development of the breast. So if the examiner is asking the question, which is the important hormone that is very important for the development of the breast, is again answer is same as per the this question. Okay. So the answer for this question, yes, who all are giving the option B as a correct answer? Very good, students. This is what I have expected for you all. So it's very important to give the correct answer for the simple questions, because no aspirants will give the wrong answer for the such a type of the simple questions. If you are making the wrong in the simple these questions, the rank will go much behind. So don't make mistake while solving the simple questions. Each question consider as the important questions. Each question solve with the concept, where your rank will flow in the top 100 students, where you will get the your desired aims. Okay, very importantly. So don't neglect any simple question. You have to do only the small thing, that is the reading the question carefully, and you have to understood what the examiner asking to you and respond to the question. That is the your answer will 100% correct. Okay. So which of the following hormone is responsible for the development of the secondary sexual characteristics? Okay, that is the your option is 100% correct. That is the B. Okay. So who all are giving the option B as a correct answer? Your answer is 100% correct. So now the question arises. Like this: the estrogen is produced from where? Yes, the answer is follicle cells of the our ovary. Okay. So which hormone is responsible for increasing the estrogen level? Yes, that is the our follicular stimulating hormone, FSH. That is the responsible for the stimulating of the follicles of the ovary. From the follicles of the ovary, the estrogen will releases. So the increase in the estrogen level, that is responsible for the, yes, development of the secondary sexual characteristics of the female. Okay, and in male also the estrogen is only responsible for development of the secondary sexual character. Sorry. The testosterone is responsible in the male. Okay. Sorry, it's a tongue twist. The testosterone is the hormone responsible for the development of the sexual characteristics in the male is the testosterone. Okay. In the female, it's an estrogen. So, in the given option, identify those two hormones that is we call as in the gonadotropins. Yes. Can anyone answer for the question? That is the our LH and FSH are the two hormone which is releasing from the our anterior pituitary of the, yes, the our anterior pituitary gland. So we call this LH and FSH together as in the gonadotropins. Okay. So these hormones are very responsible, very important for the, yes, FSH is responsible for stimulating the follicles and release the LH and release the estrogen, and LH is the hormone that is very importantly responsible for the ovulation. Though if the examiner asking which hormone is responsible for the ovulation, your answer is option A, that is the luteinizing hormone. Okay. So this releasing from the corpus luteum. Okay. The LH surge occurs, that is the 30 to 48 hours before the ovulation. Only after happening the LHR, so our ovulation will occur. Keep in mind, okay, very important. And related to the progesterone, what all are the question may develop? Progesterone is an hormone which is releasing from the our corpus luteum, okay. So when the progesterone will release after the ovulation, okay, from the corpus luteum, and if the examiner asking the hormone which is very important and responsible for the holding the pregnancy is the progesterone, okay. Hope the concept is very much clear for this question, okay. The answer for the question goes to the option B. Yes, that is the estrogen is the correct answer. I am moving forward for the next question, okay. Here is the next question. Read the question carefully, completely, and try to give the best answer. Students, in each and every one single particular question, I am solving the near to 10 questions. So it's very mandatory to be with the notebook and pen and the note the important questions where it is directly may come in your exams. Okay. So here is the next question. Yes, the most common cause of the community acquired pneumonia is. Yes, option A is the pneumocystic gyrovc. Option B is the streptococci pneumonia. Option C is the Haemophilus influenza type B. And option D is our Pseudomonas. Now I want to answer for this question. So we are having the four bacterial name. Among the four bacteria, the only one bacteria most commonly which causes the pneumonia in the community area. So I want that bacteria name which is causing the most commonly pneumonia in the community. Yes, I want the answer. Who all are the live? Try to give your best answer. Yes, whether it may be a wrong, whether it may be a right. Yes, give the best answer. If it is wrong, make it correct. Okay, give the correct answer in the exams. Whatever the mistake you want to do here, so do now only and correct your answers and give the best answer in the exams. Okay, so the most common cause of the community acquired pneumonia is the yes. What is the community acquired pneumonia? Can anyone tell? Community acquired pneumonia is the pneumonia which occurs yes in the community area and which is manifested within less than 48 hours after admission to the hospital or after 48 hours after discharge from the hospital. Okay, so this pneumonia is acquired in the community only, we will say. If in case after admission, sorry, this is admission and this is this, okay. So within 48 hours within 48 hours or less than 48 hours of the admission, if we are getting the pneumonia means that is acquired in the community only, not in the hospital, okay. And after 48 hours of the discharge, if the patient is getting the pneumonia means that is occurred in the community only, not in the hospital. So what is the hospital acquired pneumonia? Hospital acquired pneumonia is pneumonia occurring in the hospital. Means what is the time duration criteria? If the pneumonia sign symptoms coming after 48 hours or the more than 48 hours after admission, so that is what we call means after 48 hours means the patient comes to the hospital, patient get infected in the hospital only, so we are getting the hospital acquired pneumonia. And within 48 hours after the discharge, okay, within 48 hours after the discharge we are getting the pneumonia means that is the patient is get infected in the hospital and he went for the his home and he is now experiencing the pneumonic sign symptoms within the 48 hours means this is what we call as in the hospital acquired pneumonia, okay. So and this one is the community acquired pneumonia, okay. So now tell me the most common cause for the our community acquired pneumonia. Yes, who all are giving the answer as in the streptococcus pneumonia is the your best answer, students. So previously it was an Haemophilus influenza B. So when we have started giving the yes the pentavalent vaccine, so the incidence of the Haemophilus influenza B will get decreased. Now the leading cause of pneumonia in the community is the our streptococcus pneumonia. So especially in the children's, okay. So because of this only we have started the one very important the beautiful vaccine. The name of the vaccine is the PCV, means pneumococcal conjugated vaccine, where we will give the yes intramuscular vaccine for the children's at the 6 week, at the 12 week, and at the 9 month. 3 doses we will give in the very important schedules, okay. So that is the pneumococcal conjugated vaccine, okay, to prevent the pneumonia that occurring due to the streptococcus pneumonia. Hope the concept is clear, okay. And that is also helpful for the prevention of the meningitis also, okay. So Haemophilus influenza type is the previously most common cause. Now it's not a most common cause because we are giving the pentavalent vaccine, okay. So who all are live, do comment the components of the pentavalent vaccine. We are having the 5 components. Just do comment in the our comment box. Yes, who all are giving the option B as a correct answer. Your answer is 100% correct. So now tell me what about option A? Option A is telling that is the pneumocystic gyrovc. or we can say also we will call this one as in the pneumocystic carni. So this is the fungus, students. Pneumocystic carni is a fungus. So where it will causes the, yes, most commonly it causes the pneumonia in the immunosuppressed patient like HIV, immunosuppressed patient who are taking the steroids or the immunosuppressant medications for the organ transplantation. So from those patients, and in especially in the HIV patient, which pneumonia is occurring is that is the fungal pneumonia, that is the pneumocystic zerovicea or the pneumocystic carni pneumonia. So that is mainly seen in the immunocompromised patient. Note it down. So this particular option A related, that is the immunocompromised patient, which pneumonia will occur, that is the pneumocystic zerovicea. I already asked a question in the previous exams, and it is a chance to ask in the next Norcet also. So do write it in the note. Okay, very important one. Next option C is the Haemophilus influenza. Previously it was an leading cause, now it is not leading cause. And the Pseudomonas. Pseudomonas is a very important and the most common cause for the ventilator associated pneumonia. So ventilator associated pneumonia, most common cause is the Pseudomonas, very importantly. And what is the most common cause for the hospital acquired pneumonia? That is the Staphylococcus aureus is the most common cause for the hospital acquired pneumonia. Streptococcus pneumonia is the most common cause for the community acquired pneumonia. The most common cause for pneumonia in children is also Streptococcus pneumoniae, and the most common cause for, yes, the ventilator associated pneumonia, that is our VAP, is the Pseudomonas. Okay, hope the concept is clear for this question. I am moving forward to the next question. I am explaining each and everything in detail. If you are having any doubts still, do comment in the comment box. Definitely I will respond for your answer. Okay, so here is the best answer for this question is option B. I am moving forward to the next question. Here is the next question in front of you all. Read the question carefully, completely, and try to give the best answer. Yes, this question definitely strikes in your Norcet 6 exam, students. So make a notes and revise it. Okay, that is very important. Yes, while taking care of the patient with pulmonary TB who is on the anti-tubercular therapy. ATT stands here, students, as on the anti-tubercular therapy. Okay, we will call this one as also anti-Koch therapy also. Okay, so is in complaining of the peripheral tingling and burning sensation. This is and the side effect of the dash drug. Yes, all of you will give the 100% correct answers who have read regarding the anti-tubercular therapy. That is the medications we are using to treat the tuberculosis. Okay, so option A is the ethambutol, option B is the streptomycin option, option C is the isoniazid, and option D is the rifampicin. So give your best answer for this question. I am waiting for your answer. Yes, who all are the live? Do comment fast. Yes. While taking care of the patient of the pulmonary TB who is on the anti-tubercular therapy, complaining of the peripheral tingling and the burning sensation, students, this indicating the peripheral neuritis. So, which drug is having the side effect of the peripheral neuritis among the all given? Yes, very important. Who all are giving the C answer for this question is 100% correct. That is the isoniazid. Due to the deficiency of the our vitamin B6, due to the deficiency of the vitamin B6, that is the pyridoxine. So it is having the side effect of, yes, that is the peripheral neuritis. If the peripheral neuritis is happening means the tingling sensation, the burning sensation will occur as a side effect of the our isoniazid due to the deficiency of the vitamin B6. So the examiner may ask the question like this only. Okay, so another way to ask the question is like this: which of the following vitamin you will give to the patient who is on the anti-tubercular therapy, especially on the isoniazid is the vitamin B6, and the chemical name of the vitamin B6 is the pyridoxine. Okay, so the exam asks the question like this only, repeatedly asked question that will definitely strikes in your exams on this concept. Okay, keep in your mind. So what are the other questions may arise from the anti-tubercular therapy? I will here to explain. So isoniazid is the very important drug where it is causing the peripheral neuritis. And another one question may arises from this one, that is the, yes, very importantly, non-viral hepatitis. Means viral hepatitis means the hepatitis, the infection, inflammation of the liver is occurring due to the hepatitis A, B, C, D, and E without any serological evidence of the our viral infection. If again hepatitis occurring means that is very commonly and most commonly occurs due to the a patient who is taking the isoniazid, because the highest side effect of the hepatitis, that is the non-viral hepatitis, you will see in the patient with the isoniazid. Okay, so very important, keep in your mind. NVH is the non-viral hepatitis. This is also side effect of the isoniazid. There is many thousand plus side effects, students. I am telling the those important side effects which will comes in the exam. Okay. So next option is the ethambutol. Ethambutol, if you are giving to the patient, means before giving the ethambutol, try to assess the visual acuity of the patient. Try to assess whether the patient is suffering from the cataract or retinal detachment and any other conditions that may hampers the vision of the patient. Why? Because the ethambutol having the side effect of optic neuritis. What is the optic neuritis? The infection and inflammation of our optic nerve, students. So, which is causing the permanent damage in the vision. So, we call that one as an optic neuritis. Okay. If the patient is complaining of the blurred vision, if the patient is complaining of the the diminishing in the vision, so where we will take alert and we will inform the primary healthcare provider that the patient is experiencing the side effect of the ethambutol. So, where there may be an alteration in the dose will be done by the primary healthcare provider only. So, before giving the ethambutol, it's mandatory to check the vision of the patient and it's mandatory to inform the primary healthcare provider if the patient is complaining of the blurred vision. Okay, so the side effect of the ethambutol goes as in the optic neuritis. And option B is the streptomycin. So, what is the streptomycin? It's an aminoglycoside drug. Here we are now we are using as a second line drug. So previously it was also in first line. Now we are using this one as a second line drug. So in the first line we are giving the four important antitubercular medications. That is the rifampicin, isoniazid, pyrazinamide, and ethambutol. Okay, HRZD only the four medication, and streptomycin now it's considered as in the second line drugs. So this medicine also having the one important side effect, that is eighth cranial nerve damage. So eighth cranial nerve is the vestibulocochlear nerve. Okay, that is the eighth cranial nerve. If anything getting damaged in the vestibulocochlear nerve, so the patient will complains of the vertigo. Why? Because the nerve that is responsible for maintaining the balance in the our eyes, that is the vestibular part of the nerve. So that is getting damaged, means the patient will having the vertigo, means the he is having the sensation of surrounding. Okay, so and next is the cochlear nerve getting damaged, means the impairment in the visions will come. Impairment in the hearing will come. So here there is a person is experiencing the sensory neuronal hearing loss. So that is due to the streptomycin. Okay, side effect where we are getting the eighth cranial nerve damage. So that is the eighth cranial nerve damage. There is the vestibulocochlear nerve damage where the person will complain of the vertigo and person will complain of the hamper in the vision. Okay, very important. You have to understand and the give best answer for the exams. Okay, and what about the rifampicin? Rifampicin, all of you know that there is the pink to red urine. Pink to red urine is coming, means yes, that is the very normal in the patient who is taking the rifampicin. No need to inform any primary healthcare provider, because if the patient who is taking the rifampicin, it's a normal finding. We need to counsel the patient that, dear TB patient, you are taking the rifampicin and your urine and your sweat and your tear and your stool also, even in case of stool also, will come in the red to pink in color. No need to worry, it's a normal finding. Okay, otherwise the patient will discontinue the medication. And the primary goal of the DOTS therapy, that is the directly observed treatment short course therapy. So now we are giving at the under the program of the National TB Elimination Program, and the DOTS therapy previously started in the which program? That is the Revised National Tuberculosis Control Program, that is the RNTCP. Now we are regulating that one under the our National TB Elimination Program. So the main purpose of that exam is to maintain the compliance with the medication, where if the patient taking the 2 days 3 days medication and he is discontinuing, means the person who is having the TB will get resistance to the TB, and the resistance TB will be very dangerous TB, which can damage to the entire nation and entire Asia also. So very importantly, we need to maintain the compliance with the drug. So that is, we are telling the ASHA workers who are working at the periphery to go and observe directly to the patient who is having the TB to take the medication. Okay, so that is the DOTS therapy. Very importantly, the DOTS therapy full form, if the examiner asks, the DOTS stands here the the directly observed treatment short course. Okay, so the RNTCP is Revised National Tuberculosis Control Program, and the now we are having the elimination program of the TB, that is the National TB Elimination Program. Okay, so that is the NTEP. Hope the concept is very much clear for this question. Okay, so the rifampicin, one more important question may arise from the rifampicin. In the rifampicin, red to urine, pink color urine, that is the normal, no need to worry, we need to counsel, that's it. Okay, But if the TB patient is the newly married couple, if the TB patient is sexually having the active, okay, and very importantly, those are on the oral combined pills means the rifampicin is the medication which decreases the efficacy of the OCPs where the couples even they are taking the OCPs means there is a highest chance of getting pregnancy is there. Because of that, the patient who is taking the rifampicin as a nursing officer, we need to educate the patient. You have to use the non-hormonal methods of the contraceptives where it will come as in the female condom, male condom, diaphragm and all. So why? Because the rifampicin will get decrease the effect and efficacy of the our OCPs where there is in the chance of getting pregnancy is also there while taking the OCPs and the rifampicin together. So we need to educate the patient to use the non-hormonal contraceptive. Okay. Hope the all concept which are arising from the ATTs are clear. If you have any doubt, so do comment in the comment box. I will reply for the question. Okay. So here is the next question. Is do solve the question, read the question completely carefully and try to answer for the question. I am explaining the each and everything whether that is aims may ask. Okay, so not in simple exams. I am explaining the Norcet questions only and the all other very important central government exams questions like JIPMER. All of you have seen the level of the JIPMER question. You can't solve by solving the one liners and all. If you are having the concept what I am explaining here, so these concept if you are applying over the scenario based on the practical based questions where there is a chance of getting the right answer is 100% there students. So that's what I will tell. The question may short here, but the explanation comes in the scenario form. The explanation comes in the case scenario form and the practical form. That is very important and helpful for you all. Okay. So the question is like this: which of the following is also known as the Hansen's disease? Very important one liner and very important question. Okay, so option A is the pulmonary TB, option B is the pertussis, option C is the leprosy, option D is the Japanese encephalitis. Students, I want your 100% answer for this question because it's a very important question and this strikes in the exams the other names of the diseases. Yes, I'm waiting for your answer in the comment box. Who all are live, give fast your answer. Yes, which of the following is also known as the Hansen's disease? Option A is the pulmonary TB. The pulmonary TB is also known as the which disease, students? Yes, that is the Koch disease, students. Why? Because the TB Mycobacterium tuberculosis is found by the Robert Koch, and the disease of the tuberculosis is found by the Robert Koch. So because of that, the pulmonary TB we will cause as the Koch disease, and the Mycobacterium tuberculosis we will call as in the, yes, very importantly, Koch bacilli. And the treatment for TB, that is the anti-tubercular therapy, we will also call as in the anti-Koch therapy also, where in order to decrease the phobia in the society. Why? Because if the someone person who is suffering from the TB in the society means if surrounding people get know that if the person is having the TB, so the persons and their surrounding peoples, their own people start to avoid that person. So it's a very bad thing where the practice what is happening in the society, students. If the person is having the TB and if he is taking the anti-tubercular therapy for more than 2 weeks, he is non-infective to the anyone. He will never ever share his infection with others if he has taken the 2 weeks of the anti-tubercular therapy. After taking the 2 weeks of the anti-tubercular therapy, the person is no more infectious in the our TB. So we need to educate the society that don't avoid the TB patients. Okay. So and we will changing the name of the TB also as in the Koch disease and the Koch bacilli and the anti-Koch therapy as the anti-tubercular therapy. Okay. So wherever the TB is there, wherever the tuberculosis is there, we are replacing the name with the Robert Koch. That is the Koch. Okay. So this is not an answer for the question option A. So what is the pertussis? Yes, what is the pertussis? Can anyone tell for the answer of the pertussis? Pertussis is the respiratory infection. So another names of the pertussis is an yes, the 100 days coughs also we can say. Okay. So this one we will discuss while discussing the communicable diseases. Okay. And what about the leprosy? Leprosy is also known as the Hansen's disease. Very importantly, students. The another name of the Hansen's disease is the leprosy, and option D is there Japanese encephalitis. The another name of the Japanese encephalitis is the West Nile disease. Write it down. West Nile disease. That is the another name of the Japanese encephalitis. Hope the concept is very clear and very easy question. So who all are given the option C? Yes, just I am saluting through the master nursing classes. Very good students. Here is the next question. Read the question carefully and give your best answer. Yes, this question requires the definitely it requires the notebook and pen. So yes, look over the question. While assessing this question, definitely will strike in the Norcet 6 also. I am mentioning here. Okay. So the question is like this. While assessing the level of consciousness patient, okay, while assessing the level of consciousness of the patient, opens the eye with painful stimuli. Opens the eye with the painful stimuli and makes an inappropriate sound. Follows the commands, okay, and the patient is all following the commands, and both pupils are unresponsive to the light. So calculate the GCSP. All of you have practiced the GCS, how to calculate the GCS. Now the examiner asking, since from the last Norcet, he is asking about the GCSP. So in the master nursing classes, previously only the 2 to 3 months back only, I have scheduled a video on the GCSP and AVPU score. So who are the watching those questions? So you will give the definitely 100% correct answer for the question. So if you are not watching watch that video, so do watch after this session where the each and everything with rationale and clear concept, that is how to we will solve the questions on the GCS and how to calculate the GCSP and where we will use the our AUPU score also I have discussed there. Okay. Yes, the question is like this: making the inappropriate sound and following the commands, and the both pupils are unresponsive to the light, and calculate the GCSP. Students, very important. So for this one, we need to know what is the GCS. GCS is the, yes, our Glasgow Coma scale we are using to assess the level of consciousness. Why we are using this one? That is to assess the level of consciousness. Very importantly, three components we will assess in the GCS, that is related to the eye response, verbal response, and motor response. For the eye response, minimum score is 1 and maximum score is 4. And the motor response, minimum score is 1. Sorry, verbal response, minimum score is 1 and maximum score is 5. And for motor response, minimum score is 1, maximum score is 6. So 1, 1, 1, 4, 5, 6. You can remember. So the total minimum score is 3 and total maximum score is 15. Okay. Yes, 4 plus 5 is 9. 9 plus 6 is 15. So the maximum score of the GCS is 15 and the total minimum score is the 3. Okay. Very importantly. So this is our GCS score. And for eye response, I have told it will start with the 4 and minimum score is 1. So if the person is, this is the mnemonic how we will remember the eye response by the channel name, that is the ESPN channel 1 sports channel we are having, students. So already this one discussed in the that one also. I will quickly go through the GCS score where you can revise this one and you will give the best answer for the question. Yes, if the patient is opening his eyes spontaneously means we will give the 4. If the person is opening the eye for the speech means we will give the 3. And for the pain means, if the person is opening the eye for the pain means we will give the 2, and not responding means not opening the eye means we will give the 1. Okay, this is the eye response. Okay, in the given question, the person is opens the eye for the painful stimuli. Means what is the GCS score? Yes, what is the GCS score opening for the painful stimuli? Means that is the 2. Okay, so we are taking the 2 from the eye response. Okay, and the next one is, that is the verbal response. Then to remember verbal response, we are having the 5 components. That is the our country win. Okay, so in the yesterday's cricket match with Afghanistan, our country win, where the best finisher Rinku Singh finished the match with the hat trick 3 sixes. All of you have seen that one, I think. Okay, so remember with that, our country win. So our O stands for the oriented. Okay, for orientation we will give the 5 marks. Okay, and for the country, C stands here the confusion. For confusion we will give the 4 marks. That is if the person is making he is telling the words, inappropriate words. If he is telling the words means we will take the 3. And inappropriate sound means, this is I stand here the word, W stands for inappropriate words. Okay, I stands here the inappropriate sound, where we will give the 2 marks, and no response, that is the 1 marks. Okay, the maximum is 5 for verbal and minimum is 1 for verbal. Okay, and here is our motor response. That is after finishing the match, the Rinku Singh told that can't live without fan. He told that he can't live without fan. So to remember the motor response, this is the very beautiful thing you have to remember. Can't live without fan, where the person is obeying the commands. C stands here the commands, So give out of 6 marks. Okay. If the person is localizing the pain means give 5 out of 6 point. And if the person is withdrawing for the pain means we are giving the pain stimuli and the patient is withdrawing for the pain means we will give the 4 points. And for the S abnormal flexion, F stands for the flexion. Abnormal flexion we call that one as in the decorticate also. For that one we will give the 3 marks. And A stands for abnormal extension. A stands for abnormal and extension. The abnormal extension will give the 2 marks. And N stands for no response, that is the 1 marks. So in the question where yes, the opening the eye for the painful stimuli means 2 plus, and he making the inappropriate sound. For inappropriate sound, how much marks will give? For inappropriate sound, we will give the 2 marks again. Okay. So for inappropriate sound, we will give the 2 marks, and the person is telling that he is obeying the command. Okay. Sorry, not telling. He is obeying the command means 6 out of the 6 marks we will give. So that is the yes 2 plus 6 is equal to 10. So this is now only we have calculated the our Glasgow Coma scale, not GCSP. Students, to add calculate the GCSP, we are having one formula I will tell. So first read the question completely. The both pupils are unresponsive to the light. Okay. So there is the P here. The P stands for the pupil response in the GCSP. So the both response pupils are unresponsive to the light means yes, that is very important. You have to know that pupil response to the light. If the both pupils are responsive means while we are putting the lights, the pupils are constricting, and while removing the light, the pupils are dilating. Means the both side pupils are responsive means we will give the 0 score, and the both both one is responsive, one is not responsive means one is responsive means another side is not responsive. So we'll give the -1 students. It's not only one, it's a -1 score. Okay. So why? Because one side pupil is not responding, so it's a -1. Okay. And both pupils are not responsive means that is the -2 score we will give. So in the question what the examiner asked, in the question the examiner asked, yes, the both pupils are unresponsive to the light. So our GCS come as a 10. Here we will write as a 10 of our GCS. Okay. So GCS is 10. So I am writing the 10 and plus our P is -2 students. P is -2, that is the yes -2 I am mentioning. So now get the answer. 10, this plus into minus is the minus 10 minus 2 is yes, that is the 8. This is the what our GCS P score. Okay. So the answer for the question is the 8. So that is giving the GCS P score. Very important. So this question again will come in your exam. So the answer for the question goes to the option C. That is the 8. This is how you have to calculate the GCS P score, and this is how you have to remember and calculate the our Glasgow Coma scale. So to calculate it very fast in the exam in order to save the time. So whenever you will get the paper, you are having the hall ticket in your hand. So you can use that hall ticket for the rough only. The examiner authority only told. So on the paper definitely one GCS core question will come. So write this mnemonics. Okay, not this one. You write the E, and in front of E you write the ESPN. Okay, in the exam in question you found that it's responding to pain, just mention to the 2. Okay, and next motor response, verbal response, you write our country win in short form OCW win. Okay, so OC win you can write. So you will get easily what is inappropriate word, what is inappropriate sound, and mention the score. And for motor also you can do same only, calculate the total number. Okay, if mentioning only asking the GCS, okay, only do mention the GCS. If he is asking for GCSP, okay, you just know that. So -1, -2 and 0 is the score for the pupils response. Okay, how you have to calculate means yes, that is the GCS plus P. So GCS is in the minus into plus is the minus. So we can say there is the 10 minus 2 is the 8. This is how you have to calculate the GCS P score. Okay, so hope the concept is very much clear for you all. Okay, so here is the next question. Yes, do read the question carefully, completely, and try to answer for the question. Yes, the question is like this: which of the following finding need to be reported immediately to the primary healthcare provider in post bronchoscopy and biopsy case? So after doing the bronchoscopy and after taking the biopsy from the bronchoscopy, so which of the finding in the given option you have to need to report immediately to the primary healthcare provider? The question is very important, and the question will come definitely in the exam. Okay, option A is the dry cough, hematuria, option C is the bronchospasm, and option D is the blood streaked sputum. Means the sputum is coming, in the sputum the little blood is coming, that is what we call the blood streaked sputum. Okay, so now tell me the answer for the question. Okay, so that is the dry cough, hematuria, bronchospasm, and the blood streaked sputum that need the immediate attention, students, and that we have to immediately inform to the primary healthcare provider. Students, remember that who all are giving the option D as a correct answer. So this is normal or this is expected for first 12 hours to first 24 hours of the bronchoscopy. Why? Because we are seeing the our so-called bronchus, and from the bronchus we have taken the biopsy, means we have ourselves only we injured the tissue and we have the taken tissue for the study. So that is what we call the biopsy. So because of that, the minor blood will come with the sputum. It's normal for first 12 to 24 hours. After 24 hours it appearing, means you have to inform for the primary healthcare provider. So dry cough and hematuria is not related to the our bronchoscopy and the biopsy, students. Where the bronchospasm, yes, who all are given the option C as a correct answer. Your answer is 100% correct. The bronchospasm is the spasm of the bronchus is occurring, means the airway is occurring, means the our basic unit, means the basic of our life is getting obstructing, means there is a life threatening condition is arising. So because of that, the bronchospasm, the airway obstruction, need to immediately report to the primary healthcare provider. That occurs after the usually after the bronchoscopy and the biopsy. Okay, due to the our bronchus irritation. Okay, so it's very important to immediately give the response to and immediately attend the patient and inform to the primary healthcare provider after the bronchoscopy and the biopsy. And what are the other questions may arise from the bronchoscopy? Sorry. Yes, what are the other questions may arise from the bronchoscopy? Whether we need to maintain the NPO status for the bronchoscopy? Yes, tell me whether we need to maintain the NPO status. Yes, absolutely. We will maintain the 6 to 8 hour NPO status for the bronchoscopy. Why? Because we are giving the local anesthesia at our, especially at the throat area while inserting the bronchoscope. Why? Because it, if you without anesthesia we are inserting the bronchoscope, it will induce the gag reflex where the GI content will comes to the our up to the our pharynx and larynx, where it will enter into the lungs, which leads to the aspirational pneumonia. So to prevent the aspirational pneumonia, we need to maintain the NPO for the 6 to 8 hours before the bronchoscopy. Yes, it's absolutely correct statement. Okay, there is the NPO should be maintained for the 6 to 8 hours. Okay, so and local anesthesia should be spray. One lignocaine spray will come. So before bronchoscope, we will ask the patient to open the mouth and protrude the tongue out, and we will press the spray over the posterior part of our pharynx where we are the paralyzing the larynx. Okay, so until the gag reflex will return, we will never ever give anything through the mouth. Okay, post procedure also, after doing the bronchoscopy also, until the gag reflex will particularly establish, until that and the swallowing ability will establish, until that we will not give anything through the mouth. Okay, so it's very important. And post bronchoscopy, which position we will maintain? Yes, that is the our semi-polus to the high polus position you have to maintain. Why? Because there is a chance, there is a risk of the aspiration also. To prevent that one, you have to maintain the semi-polus to high polus position. The examiner want to ask the one question. The patient, if he is given in the exam, the patient is conscious, just give the high polus. If he is semi-polus, if he is semi-conscious, give the semi-polus question. Okay, so hope the concept is clear. And the answer for this question also very much clear for you all. Okay, so here is the next question in front of you. Read the question carefully, completely, and try to give the best answer for the question. Yes, the question is very important. That is the which of the following drug is responsible for the fecomalia? Fecomalia, we call this one as in the short arm and limb syndrome. Okay, so which of the following drug which causing the responsible for the fecomalia as a teratogenic effect? So now tell me, what is the teratogenic effect? Simple, students. Teratogenic effect is, I will explain in simple local language, that if the mother is pregnant and he is taking the medication, that medication crossing the placenta and causing the damage to the fetus, that is what we call the teratogenic effect. The teratogen is that particular substance which causing the damage to the fetus when the mother taken it. So that is the teratogen, and the teratogenic effect is the, yes, when the mother takes the medication, it will damage the baby's morphology, baby's physiology. So that one we call as the teratogenic effect. Okay, so hope the concept is clear. Now, which drug the mother is taken during the pregnancy and which causing the phacomalia in the our babies. Okay, phacomelia is the, yes, that is the short limb syndrome. Okay, so it will looks like this. Look at the image, students, how the baby is smiling very beautifully, and he's look at his arms, only short arms he developed, students, and the short limbs also he developed. So this is what we call as in the phacomelia. So this is what we call as in the short arm and limb syndrome. This occurring due to the, yes, very very important, who all are giving the option B as the correct answer, thalidomide. That is the very very importantly, your answer is 100% correct. The phacomelia that occurs due to the mother, if she is taking the thalidomide during the pregnancy, so she will, okay, she will experience the phacomelia. Sorry, her baby will born with the phacomelia. So it's very very important and repeatedly asked a question. So what happens if the mother drinks the alcohol during the pregnancy? So where we are having the one very beautiful syndrome, that is the alcohol. Yes, alcohol. Can anyone tell the name of the syndrome? That is the, yes, that is the fetal alcohol syndrome. Yes, very very good. So where are the abnormalities will arises? Can anyone tell that? Yes, the abnormality will mainly arises over the face. Okay, so the absent of the nasal bridge. Okay, so short upper lip. The upper lip will be very short, and the nasal bridge will be very depressed inside, and there is a wide gap between the eyes and the short forehead. So these all are the, yes, the clinical pictures of the baby with the fetal alcohol syndrome. If the baby born with a flat nasal bridge, is the short upper lip, short forearm, so sorry, forehead. So we will ask the mother whether you have took the, yes, alcohol during the pregnancy. Yes, she will tell that, yes, I have, yes doctor, I have took the alcohol during the pregnancy. So the baby is born with the fetal alcohol syndrome. Okay, it's very dangerous. Always, because of that, we'll always advise the mothers, especially the modern mothers who don't know about the fetal alcohol syndrome. In the first trimester visit only, the doctor, the obstetrician will counsel the mother that don't take the alcohol, don't take the thalidomide, and don't to take the sodium valproate. Who will take the sodium valproate? Yes, the mother who is having the seizures, to treat the seizures, she is on the sodium valproate means, she is taking the sodium valproate means, this will cross the placenta and this will cause the neural tube defect. The teratogenic effect of the neural tube, sodium valproate is the neural tube defect. Repeatedly asked a question, and this occurs due to the deficiency of the folic acid. So you have to remember the neural tube defect is a teratogenic effect of the sodium valproate. Okay, so the answer for the question is the option B. That is the thalidomide, which causing the phacomelia. The phacomelia baby looks like this. That is what we call the short arm and short limb syndrome. Okay, so the hope each and every concept is clear for you all of the today's session. Okay, so here is the last question of the day. So read the question carefully, completely, and try to give your best answer for the question, students. Yes, the question is like this: which of the following anemia occurs in the patient with the bariatric surgery? So now tell me, what is the bariatric surgery? Then we will go for the our question. Yes, you want to give the answer for the question, means you have to give, read the options. There is the iron deficiency anemia, pernicious anemia, dimorphic anemia, and aplastic anemia. So give the answer for the question. Yes, I am waiting for your answers. Give the answer for the question. So which of the anemia occurs in the patient with the bariatric surgery? Yes. If you don't know the answer, means I will explain the answer. Don't worry, students. This is our structure of the normal stomach. Okay. So this is our structure of the normal stomach, where the food will come and the food will digest and the food will get absorbed. So the girls, the dancers, okay, the celebrities who all are getting fatty nowadays, going for this kind of the surgery. The surgery's name is called as on the bariatric surgery, where they are reducing the stomach size. Okay, where there is a less food will be there. Okay, less absorption will be there. So less absorption, because of the less absorption, so the less weight gain will be there. So because of the weight gain phobia, they are adopting for the bariatric surgery. And this bariatric surgery usually we will use for the obesity patient to decrease the obesity by decreasing the, yes, the stomach size. So that is what we call the bariatric surgery. This is also called as the gastric size reduction surgery or the bariatric surgery. Okay, if the person is having the bariatric surgery, so what is the, which deficiency anemia will occur? Mostly iron deficiency anemia occurs in the mother who will not take a proper iron. So because of that, we have started one program, that is the Anemia Mukta Bharat program. So after After the 3 months of the pregnancy, we'll start with the Anemia Mukta Bharat program, and before that one, we will give the folic acid to the mother. We will discuss that one separately. Okay, so the iron deficiency anemia occurs due to the less intake of the iron. Okay, so it's usually seen in the pregnant mother. Okay, and what about the pernicious anemia? Why the pernicious anemia occurs? So what is the vitamin which is having the deficit in the pernicious anemia? Do comment for students which deficiency, vitamin deficiency lead to the pernicious anemia. Yes, which vitamin? A very good students who all are giving the vitamin B12 as your answer. Your answer is 100% correct. The name of the vitamin B12, that is the cyanocobalamin. Okay, the deficiency of the vitamin B12 that occurs as in pernicious anemia, where we are getting the one special type of the tongue, that is the, yes, BP red tongue, the classical picture of the pernicious anemia that occurring due to the vitamin B12 deficiency. Why it occurs in the bariatric surgery? Why it occurs in the bariatric surgery? Students, as all of you know that there are many types of the cells in our stomachs. Okay, so among those, one cell, the name of the cell is the parietal cell, which releases the intrinsic factor. This intrinsic factor, which is releasing from the our stomach, is responsible for the absorption of the vitamin B12 at what level? Yes, at our terminal ileum. Okay, at the terminal helium, the vitamin B12 will absorb. So to absorb the vitamin B12, the intrinsic factor is much necessary. So when we will do the gastric reduction surgery, the parietal cell will get damages, the intrinsic factor will decreases. So the decreased intrinsic factor, decreased absorption of the vitamin B12. Okay, so decreased absorption of the vitamin B12 means we are having one beautiful type of the anemia, that is the pernicious anemia. Where how can we will identify the pernicious anemia? Yes, that is by the red beefy tongue. Okay, so from here we are seeing a red strawberry tongue, where we will see, yes, in the Kawasaki disease and in the scarlet fever we are getting the strawberry like tongue. Students, note it down. So different types of the tongue color. In the anemia, pale tongue. Okay, normal anemia. In the pernicious anemia, red beefy tongue. In the Kawasaki disease and in the scarlet fever we are getting the strawberry color tongue. Okay, so very importantly, in the iron deficiency anemia we will having the special features in the nail, that is the, yes, the spoon shaped nail, that is the chylonychia. Okay, the clinical features of the anemia will discuss later in detail. Okay, so the dimorphic anemia means, what is the dimorphic anemia? So because of that, the bariatric, I will clarify this concept first. So because of the damaged parietal cell, intrinsic factor decreases, vitamin B12 decreases, and we are having a beautiful anemia. There is a pernicious anemia that occurs due to the decreased vitamin B12. Okay, so now tell me, what is the dimorphic anemia? Dimorphic anemia is the anemia which occurs due to the both iron deficiency and folic acid deficiency. The most common type of the anemia in the pregnancy is the dimorphic anemia that occurring due to the folic acid deficiency and iron deficiency both. Okay, so the dimorphic anemia. So what is the aplastic anemia? Aplastic anemia occurs usually due to the bone marrow suppression. So due to the bone marrow suppression. Okay, so pancytopenia we will see. What is the pancytopenia? Pan, wherever the word pan comes, it is whole. The pan India movies means, the pan India means the whole India movies. The pan world movies means the whole world movies. Pan is the word, it's telling the whole. Okay, so pancytopenia, pan means the whole, cyto means the cell, penia means decreasing. So pancytopenia means decreasing all RBC, WBC and red RBC, WBC and platelets. So we call that one as the pancytopenia. Okay, so that is will be seen in the patient with the aplastic anemia or the bone marrow suppression cases. Okay, so these are the very important questions we have discussed in the today's class, friends. I hope the class is very informative to all. So in each single and best questions and the one liner to the all scenario based things and the practical things I have explained with you. So do remember and revise the notes after completing the question. And as I told, so if you are interested means you can watch my GCSP core class, where I have told everything with the clear pictures, images, and the proper techniques how to solve the questions. That is on the AVPU and the GCS. The link I will give in the description box. Okay, so if the video is helpful for you all, so don't forget to press the like button. And if the content is helpful for you all, so you have to do only one small thing. And so the small thing is to share the class with your friends, share the class in your classmates. Okay, share the class in your college groups, so where we can found the highest subscriber and where we can grow our channel very nicely. That very importantly boost me to create the such very important content. So to create the classes for you all, so I will read the 4 to 5 books to solve the concept very easily. So after reading the all those, I am telling in front of you. So it is not possible to talk 1 hour continuously. If you are having the sound preparation only, you can express soundly. Okay, so we are struggling for giving the best content to you all. For that, so don't forget to subscribe, don't forget to like, and don't forget to share. We'll meet again in the 9 to 10 special class tomorrow. Don't forget the time. Just schedule the time for the master nursing classes. Definitely your rank will increase in the narcissistic students. Okay, so we will meet again. So tab tak ke liye jai hind, jai bharat.